Hello viewers, welcome back to Candid Conversations with Ganesh Kuppala. Thank you so much for response that has been given to this show. As you have seen in the recent times, I've been talking to various specialists in the field of healthcare, and we had multiple doctors on the show previously. Today, I have privilege of bringing another doctor who's all the way. He traveled to UK from India, attending Commonwealth Medical Association international convention, sorry. So he's here. Dr. Prabhu Kumar is with us today, who's the convener for Artificial Intelligence and Digital Health, Commonwealth Medical Association. And he's also heads the Hyderabad Indian Medical Association as well. And he also heads a lot of other organizations and different committees.
Yes.
Thank you so much, Prabhu Kumar, for all your work that has been done in the medical associations and all. So thank you so much and welcome to the studio.
Thank you, Ganesh, for inviting me for this, program, and it was wonderful to come here. As you know, I came for the Commonwealth Organization Inter-Countries program, where we have come for the work that should be carried to all the countries without boundaries, and especially Commonwealth countries, which are 56 countries which we have, and which is under the umbrella of the Queen of England, now the King of England now, and these aim of the Commonwealth Medical Association is to see, the education goes beyond boundaries. The medical education, the standard medical education, the Royal College physicians, the standard format to go towards the ends of the earth where, people practice medicine, English medicine, modern medicine. So it's our aim to see that through the collaboration with RCP, Royal College Physicians or Royal College Obs and Gynec or other British Thoracic Society. We are trying to, collaborate with all these countries involving artificial intelligence too.
Okay.
Because now the artificial intelligence is the main tool and the digital India or digital to all countries. Because as I come from India, I'm privileged to work for India. Involve India more in the digital platform hereafter. This is our main motto, to see that the medical care reaches without boundaries.
Brilliant. So before we get to the details of CMA and your role in IMA, Dr. Prabhu, I would like to understand, for my audience, I want to get a glimpse of like how you started this journey. Where are you originally from? And where did you, complete your graduation? Then up to you did your MD as well in UK. Then you went on to studies diabetics. In United States. So you did a lot of. So can we quickly go through your background?
Yes, I born in Nagarjun Sagar.
Okay.
Which is in the Telangana state.
Yeah.
And then I went to different parts because of my father, who worked as an engineer in electricity board those days. So I need to travel. But my father and their families, ancestors, they had their journey from Ongol, so a small village called Bestwarpeta, long back. Maybe, I'm the fourth or fifth generation guy. So it's been I born and brought up in most of my time in Hyderabad. I did my medicine in SBS Medical College, then did my internship in Gandhi Hospital, Gandhi Medical College, then worked in Usmania for some time. Came to London. I know, by the way, I came to London. I was in Buckinghamshire, Buckingham University, doing my MD, worked in Ealing and Blackpool, Victoria, and I roamed around the whole parts of London, the United Kingdom, basically. United Kingdom consists of the London, the Wales, the Scotland and Ireland, and I was in these three areas working, and then I have very good connections with Ireland too, Northern Ireland especially. I had good friends over there, so I traveled to Ireland most of my time. So that's where I did my MD here, MRCP, connected to London and Royal College Physicians from the beginning of my career. And then I did my endocrines from Johns Hopkins, USA. So then gone back to India. Okay. See, primarily the motto of my dad and my family or my mother is to see that every citizen gets the right medical care, the proper standard medical care. See, if you see India, till today, in a peak time, if you go to any government hospital, you'll see 4 to 5 patients on the bed. Still today, if you go in a peak time, you'll see really 4 to 5 patients on the bed and another 4 on the floor. So this is the pathetic situation from the ages which we are seeing. That's where I concentrated from
Isn't
EA.
that changed, Dr. Prabhu? At least in the last decade or so, I thought especially the southern states of India
Yeah.
have improved significantly with the
See,
healthcare.
the care has improved. Definitely the care has improved. But the scenario is the same.
Because of the population.
Because of the population. See, you see patients, till today you will see in the media, the boys and girls from different mountains or the tribal people are brought on the shoulders to the hospital, brought on a baggage to the hospital. And these are the sad parts which we look at. And this is where, Commonwealth even looks at. That's what I'm always passionate about. See, finally the aim is to see that the governments of all nations should take care of their health of their citizens, which should be on priority. Rather, now we see in different countries and different nations, not only India I'm speaking about, but different nations. We are proud of India, of all the heritage and that we are carrying. But at the same point, we should be also, considerately look at how we can reshape the health structure in India. We have all the basic, primary healthcare structure we have, which is there till PHCs, primary healthcare centers, and then district healthcare centers, and then, the tertiary centers. But on the whole, what I see is that the change did not come to the levels. What I'm expecting is in a primary healthcare center, there should be the proper care should be given by a physician or a doctor or by MBBS doctor, because lots of doctors are coming out now. India, as you said rightly, that there is a growth in the doctors coming out. Young doctors are coming every year out.
Yeah.
But we are not providing them the job score there that they should get into those field. Because the field is ready, the doctors are ready, but the gap is not still managed by the government. So I request sincerely the governments of various countries, of these 56 countries, to look into that, because we are producing young graduates come out, and these graduates should get into that post and see that the primary healthcare structure should be improved.
Yeah.
So that if the primary healthcare is improved, it is a backbone of the nation, that if you can improve the primary healthcare, the whole country becomes healthy.
I understand.
And many people say that it is an expenditure by the governments, but it is rather an investment by the governments for the welfare of their citizens and for the future of the citizens, for the future of the countries.
Yeah, healthy nation becomes a wealthy nation, obviously.
Yeah.
So, but yeah, one thing I do want to call out, Dr. Prabhu, because I hail from Hyderabad as well originally, but I've been living in London for some time. And by the way, welcome to London. And we met in Commonwealth Medical Association convention as well. We both met, we had a conversation, and I thought I should bring Prabhu onto this candid conversations to see how things are working in India and what is the healthcare. Primarily, Dr. Prabhu, what we notice, I live in London, so I don't live in Hyderabad right now, but what we hear in the news and all, especially in the last decade or so, last 5 years in Telangana, we have seen significant investment in the form of a lot of medical colleges. They now have 30 plus medical colleges in Telangana.
Yeah, we have,
which is incredible, right?
Yeah. So it's incredible and great. But the thing is, now the NMC recently has come, National Medical Commission has come and stopped the medical colleges, saying that you don't have proper infrastructure.
Oh, that's interesting.
That is the saddest part. See, here, having a medical college is different. Having a proper medical college with all the infrastructure, with all the facilities. So just going down and opening a medical college is very easy, very simple. But maintaining proper infrastructure, having proper faculty, having the lab facilities, having the necessary professors, departments, and then needful things for the doctors is very important. To train a young doctor, it is almost 1 crore.
Yeah.
Maybe 100 million or 1 million or 100 million.
Less than 100,000.
100,000, yeah. 100,000 pounds you need.
Yeah.
See, to make a doctor, such precious life is for doctors. So what I would really suggest is, as we are trying to make incredible India, when we are investing so much on the medical colleges, they should see properly that proper infrastructure is also maintained and managed.